Hey guys, before we get going with this adjustment video, just wanted to talk about the next giveaway. I'll be giving away 4 free adjustments, so an adjustment for you and 3 of your friends. There's going to be 3 requirements though. First and foremost, obviously be subscribed to my YouTube channel. Secondly, I'm trying to grow my Instagram, so follow me on Instagram. I'll leave that in the comment section, in the description. And then lastly, on this video, I want to know the 3 friends that you are looking to bring with you. And also let me know why you guys want to be here, what's going on in your lives, just a quick little thing that's going on. So those are the 3 things, and reserve the winner. Can't wait to see you. Enjoy the video.
And weren't they trying to tell you to get surgery done?
Yeah.
That was your only route to take?
Yeah, they said that was my only route to getting fixed, and he continuously told me that they would have to fuse me.
The entire lumbar spine,
yeah, the whole
right?
lumbar.
Gotcha.
And then the pain was so intense, it's like the worst Charlie horse. You know, like you work out, your muscles draw up. That's what it was constantly. Jeez. And he would never do anything. I begged him in tears to give me some type of relief, and he said there was nothing he could do. Oh my God. I don't even feel the pain in my hips anymore.
Were you able to do that?
No, I couldn't even pull my knee up to my waist. And now I can.
Yeah.
I'm still popping. This is weird. This is awesome.
Good.
Thank you, man. God,
Definitely.
Thank you. I ain't gonna lie, I want to cry. It feels so good.
Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. Now, well, I'll let you explain, just like you explained to me earlier, everything that was going on.
I had an accident. I broke my S5 7 years ago, and I have a lot of sciatic pain in my hip and my lower back, and I feel like I'm compressed constantly, and shoulders feel like I'm flexing 24/7, and I cannot get any relief. I probably get 3 or 4 hours of sleep a night. That's it. Okay. And I work 12-hour shifts. Okay. So it's.
Yeah, trust me.
Some relief. I
can tell just by looking at you. You look tired.
I am.
You look tired. I'm not trying to be mean or anything with that one, but right. Now I know. Yeah, you're telling me shoulders. You feel like are just always pulling forward like that. You some mid back issues, and then that low back. Now you're telling me also, it went from quite a bit of pain, but then you said like you felt a pop almost one day, and now there's a spot on your leg that's you don't even feel anymore.
Yeah, I can pinch it. You know what out of it, and I don't feel it.
No feeling at all.
I feel to the touch, but it's nothing like this side. Okay. And this side you barely even pinch. I feel it. I don't even feel any tight, anything like pinches or anything. Okay, and then you're even telling me just the other, what was it, last week or something, you said you're trying to get out of your truck? And the legs stopped working. Just didn't even work? Yeah, it didn't work. Fell out of the truck? Yeah. Okay. So it's been that happened. My leg was doing that when I broke it. It started doing it months after that, and then it stopped, it cleared up. Okay. So it's been, I'd say the last 6.5 years. Yeah. I've been able to have motion and movement and stuff in it, but then just the other week this happened. Gotcha. So it's like it scared me like it's going to happen again. Gotcha. Alright, let me have you stand up. Yes. We're going to go through some ranges of motion first. Let's work on the neck. So I want you to look all the way up at the ceiling for me. Pain, tenderness, tightness, pulling.
Tightness, and I feel it all in in the top of my shoulders.
Okay. Look all the way down to the ground. Any issues with that?
Yeah, I have to strain and pull my head down.
Okay. Bring one ear to one shoulder.
That's all I got.
Okay. To the other side? More on that side?
Yeah, it's so tight.
Okay.
On both sides.
Rotate over either side.
It's still it's no free movement, it's all tight.
You gotta actively, really, okay. Let's drop down to the lower back. I'm gonna have you bend forward at the waist. How's that feeling?
I can't even hold it up to touch my toes. It's all the pain, it's tight.
Okay.
It feels, if
if you ever have a joint like it needs to be popped and that's what it's constant and it's like it's in a bind or something, I don't know.
Okay. Let's have you extend back like that. How's that? Painful?
Oh yeah, it's painful.
Okay.
Terrible.
When you come down on either sides?
It's all on the right side, it's all in my hip and it runs down to my leg.
Before, above the knee though, correct?
Above the knee.
Okay, and then to the other side?
The left side, I pretty much
feels fine.
Feels fine.
Okay. Now if you rotate, any issues with rotating?
More on the right side than the left. It's like I have to force the turn on the right side.
Yeah, it looked like you turned actually a little bit further. Yeah, more range of motion going
and
down.
then it's like, it's all I have got.
Okay. Let me have you lay face down.
Okay.
I'll take your,
Oh.
I'll take that. No, you get it. Face up here. I'll have you bring your hands right down there. Perfect. Alright, so we're going to scan the body. We're going to go from that cervical spine, checking the leg length. We're going to check that symmetry from the right side compared to the left. Alright, let's palpate in. Let me know if anything is tender to the touch, okay?
Okay.
So we're just feeling the spine and the surrounding muscles and ligaments here. Alright, we go from that cervical spine into the thoracic here.
Right there.
Right, some pain more on the left or the right?
On both sides.
Both sides. Yeah, we're making our way down that thoracic spine here.
Right there.
Okay. That's at that bottom of the thoracic and the top of the lumbar spine. Now we're... Alright, all through that lumbar spine.
Oh, God.
Okay. Any pain over that right SI joint? Not much?
Not much. It's bearable.
Okay, what about the left side?
It's the same. It feels the same.
Okay. Let's check the leg length out. So leg length is not terribly off at all. So it's almost, I mean, I'm trying real hard. It's almost balanced, but let's see. When we scan up the body, yeah, when we scan up, just the one thing that I'm really seeing a lot of, got a little bit of like an extra kyphosis. So you see like right in through that mid back in here. Okay. Yeah, I'll show you on this. Look up a little bit. So the spine should be more like this, and you just got a little bit more kyphosis like that in the spine. So what we're going to be doing, we're just going to be removing the pressure off of these nerves, just to allow the body to function and to heal.
Okay.
So now, granted, everything was super tight, so we're going to use that hypervolt. Just going to relax everything for you, and then we'll start with the adjustment.
Oh my God.
Okay.
Wow.
Alright, let's go ahead and get started with the adjustment here. Okay, I always like to start up top of that cervical thoracic junction. We're going to start with the T3 on that left side here.
Oh my goodness.
Drop down to T2 on the right.
I felt that in my left wrist. Oh.
Alrighty. Take a deep breath in and let it out. There we go. Deep breath in and out. Good.
Wow.
One more time. Deep breath in and out. Good. Okay. We'll recheck that leg length. So yeah, it's still the same. His leg length was staying pretty balanced there, which is a good thing. Okay.
When I'm sitting down, I constantly feel like my lower half, like my hips, I always turn towards the right. Just,
Like turned like
yes,
that?
I don't feel like I'm sitting when I take my wallet out of my pocket and everything. It just...
I'm gonna have you sit up on the table for me, straddling the table, one leg on either side.
Okay.
Yep. Starting to notice a difference already?
Yeah, it's like things are breathing.
I'm gonna rotate you this way. Keep your thighs to the table. Look as far as you can over that shoulder for me.
Oh my God.
Go face down again for me. There we go.
Oh, I actually felt that in my knee. Oh my God.
Well, that right side, that was the side in here was that where you're not feeling much, right?
Yes.
Okay. Alright, we're going to drop down to the sacrum here. Raise that right leg up as high as you can. Any pain? Okay, relax. Raise the left side up for me. Alright, you can actually raise it the right side. Alright, cross that right leg over the left leg for me.
Okay.
Alright.
Can I take these things off?
Yeah, drop them.
Okay.
Alright, table's going to come up from below you. Okay, so what we're going to be doing, as you guys can tell, I couldn't even raise that right leg up. So his sacrum is pointing more towards that left side. Do a quick visual. His sacrum is pointing more towards the left side like this. It's allowing this leg to actually raise. Everything through here, those ligaments and tendons are so tight he can't even physically pull this leg up. So we're going to do P to A drops, just meaning from posterior to anterior, and we're going to do that counterclockwise torque so we can bring the sacrum back to the middle like that. Uncross.
Oh my God.
Bend just this knee. Good. Let's get one more in there. Let's get one more. Good one in there. There. Bring it down. Raise that right leg up for me this time. Can you lift it up from here? How's that feeling?
So,
You're actually raising it.
oh my God.
Last time,
Still some
little
a little
soreness.
soreness, but it's not as the
Good.
pain isn't severe as it was.
Good. Yeah, you're actually raising it this time, where last time you weren't. Alright, I want you to lay on your side, and I want you to face me this way.
Okay.
I'm going to bend that top knee. So I'm actually going to take this arm, just going to drop that shoulder. There you go. Just like that. There it was. Flip to the other side for me.
Oh, me. Wow. This is amazing.
You still haven't had the Y-strap yet.
Oh my God.
Just wait.
I can't wait.
Good.
Oh, me.
Lay flat on your back for me. There we go. So just relax your legs for me. We're going to do the leg pulls here. Relax your legs.
Oh,
Feel that up in that hip?
yes.
Good.
Oh.
How'd that feel?
That was great.
Alright, come on up.
Thank you.
Alright, stand up for me.
Wow.
Stand right here. Okay. Arms out by your side. Bring your hands up and over mine.
Okay.
Lean back into me. Squeeze your elbows together. Alright, I'm gonna have you take a seat right here.
Oh my God.
Face that way for me. There we go. See, things are straightening out now. Taking that pressure off those nerves. Alright, deep breath in. Exhale out.
Oh, that's what oh.
Relax, relax, stay down.
Oh my God. Wow.
Hands on your stomach.
Oh,
Now we're gonna do that Y-strap.
please. Oh my God. I still feel that.
Alright, just relax.
Oh! Oh!
Relax, relax, lay down. Deep breath in and out. Deep breath in and out.
Oh my God. Whoa. That's like no other.
Relax, relax, just stay there, you're good. Yeah, just breathe.
That's breathtaking. Oh my God.
How would you describe that to someone who's never had it done?
Oh, it's like no other. It's just breathtaking. You need to experience this.
Is that a little bit different than the chiropractor you
Oh
were
my
at
God.
before?
I'm tingling all over. Oh.
Yeah, just relax, relax. You don't gotta get up just yet. Let things settle in and sit in. There's a ton of movement with that.
For years I've had people walk on my back, try to pop it, and I get nothing, no relief. Oh my God. I felt that in the lower part as back as you could go.
Yeah.
Oh, even in my hips. I felt my hips pop. Can I shake your hand?
Come on up first, come on up first.
That is awesome.
I'll have you stand up.
Okay.
Alright,
I kind of feel weird.
now you have pressure off of those nerves. Yeah, you're feeling different, aren't you? Is that a little bit?
Oh my God.
Bend forward for me. Hold on, you're touching your toes this time.
I could not do this a month ago, a year ago.
You couldn't do it, what do you mean? 5 minutes ago.
It's
How,
taking some I'm not used to it. Oh my God. I don't even feel the pain in my hips anymore.
were you able to do that?
No, I couldn't even pull my knee up to my waist. And now I can.
Yeah.
I'm still popping. This is weird. This is awesome.
Good.
Thank you, man. God.
Definitely.
Thank you.
Look up, look down, do everything. Do you notice the difference in
I
the
don't
neck?
even feel there's no strain in anything anymore. It's weird.
It's weird to feel how you should feel, right?
Yes. I miss it. It's like I don't even remember. I've been like this for so long, it's like I don't even remember the feeling of being normal again, if
Yep.
that makes sense.
It does, trust me, it does.
I was told normal's not normal. Oh my God.
And weren't they trying to tell you to get surgery done?
Yeah.
That was your only route to take?
Yeah, they said that was my only route to getting fixed, and he continuously told me that they would have to fuse me.
In the entire lumbar spine,
Yeah, the
right?
whole lumbar.
Gotcha.
And then the pain was so intense, it's like the worst Charlie horse. You know, like you work out,
Yeah.
your muscles draw up. That's what it was constantly. And he would never do anything. I begged him in tears to give me some type of relief, and he said there was nothing he could do.
Jeez.
So that's all they did was shot me and shot me and shot me and shot me.
Yeah.
I had burn marks on my back from it.
Jeez.
Thank y'all.
You're welcome.
I'm still tingling. It's a feeling I've not felt for years.
Perfect. This is how you should be feeling.
I don't even feel the tension in my shoulders anymore.
Yeah, you said it was like pulling you forward?
I feel like I can breathe. Before it's like my chest felt so compressed, like I was constantly, it felt like it was a pinch in the middle of my back, so I was taking short breaths constantly.
Gotcha.
Now I can actually breathe. Thank y'all.
You're welcome.
Oh my God.
Definitely.
Thank you.
Definitely.
When can I come back? This is so weird. Oh my God, this is weird.
See, honestly, even looking at you now, just the look on your face, everything just looks like relaxed.
Constantly I was ill, mad. It was like a thorn in my body the whole time. And
Yeah.
it's like it just wiped away.
Yeah.
Who would have thought? I can't believe I can touch my toes.
Who would have thought in just that one adjustment? Did you ever think that? I mean,
No.
like you told me, you watched the
I
video.
lost all hope, I really did.
Yeah.
Well, I'm really glad that you did this before considering surgery.
Yeah.
I ain't gonna lie, I want to cry. It feels so good.
Dude,
Thank you.
you're good. You're good, man.
Thank you.
Alright. As you guys can tell, I mean, what was it, 7 years?
7 years.
7 years of pain. Doing that, literally to your body. And you're feeling, I mean, you guys can clearly see it. You can obviously feel
Still
it.
tingling all over. It's.
That's how,
I mean, the stuff that happened in my shoulders, I could feel it in my wrist.
those nerves. And I'll even show everybody, just so you realize, even how you're saying, how you're feeling it in your wrist. So in the cervical spine, in the neck here, these nerves are yellow on here. These nerves go down the neck and they come all the way down and they work on the hands. Now through the thoracic spine, it's going to all the internal organs. So you'll have, your heart, your lungs, your stomach, your small intestine, large intestines, And then, when it's going to your lumbar spine, now your lumbar spine is going to be dealing with, like going more down your legs and working your legs. So when we did those adjustments up top in the neck, that's when you're feeling it even going all the way into the wrist. Just because the pressure taken off here is relieving pressure down there.
For the past 4 or 5 years, constantly, every time I turned my head to the left, I was feeling like my shoulder was wanting to go up when I pull my head. Now it's nothing there.
Yeah.
I feel no tension in anything you've had me do.
Good. Alright, today, relax, no working.
Oh,
Okay. Increase the water.
okay.
If you do get a little soreness, just because that was a ton of pressure that was removed, and I know you've never had like that decompression done,
Nothing.
feel free to ice. I want you to ice, not heat.
Okay.
But you might not even get that at all. I just let people know that if they're feeling a little soreness, just put some ice, 10 minutes on, 10 minutes off.
I was told from everywhere, no ice, heat. Everywhere I've ever been, heat.
Heat is more for chronic. Ice is more for acute, and that we just did that.
Okay.
That decompression.
So the whole time I've never put any ice.
Okay. Yeah. Right now, I want you to do
Any
ice.
cool compressions, anything. I've always used like icy hot patches.
Yep.
It burned the snot out of you. Again, thank you, man.
Definitely. I mean, as you guys can see, that much relief, and with that one adjustment. So, trust me, if you're experiencing anything, go right to the website.
Come here, please.
There you go. That was a 5-hour drive we made. Probably wish you came here like sooner.
Yeah. See, I've been watching YouTube videos for several years now.
Mm-hmm.
And there was a guy from Houston, Texas. And I had family in Houston, and I was like, well, this is closer, and they never return my calls or emails.
Okay.
Y'all the only ones that has.
Well, I'm glad we did. And I'm glad that you got the relief.
Thank you.
You're welcome.
Thank you again.
You're welcome. Definitely. All right, guys. Have a good one, everybody.